Hi all, this is Dr. V G Nadgouda giving a synopsis of diabetes-related microvascular disease as fifth module activity. Diabetes is a global health issue. According to WHO, approximately 537 millions are living with diabetes globally, which is likely to touch 700 millions by 2040. Studies worldwide have revealed that the best way to prevent diabetic control and other complications is to diagnose and treat diabetes as early as possible and also maintain a sustained HbA1c reduction with an eye to prevent diabetic complication as well as to be patient-centric than glucose-centric. Diabetic microvascular disease involves small vessels such as the capillaries, and macrovascular disease involves larger vessels such as arteries and veins. But the complications of both have similar etiologies. Microvascular ischemic disease is also called microangiopathy and is a term that's used to describe changes in the small blood vessels in the brain, nerves, retina, kidneys, and the superficial skin. Pathophysiology. In this docket, the term diabetes includes both type 1 and type 2 diabetes, which have much the same vascular pathology and etiology. Common risk factors for vascular disease in people with diabetes, especially type 2 diabetes, include hyperglycemia, insulin resistance, dyslipidemia, hypertension, tobacco use, and obesity. Pathology of vascular disease in diabetes include effects of advanced glycation end products accumulation called AGEs, nitric oxide inhibition, smooth muscle cell dysfunction, overproduction of endothelial growth factors, chronic inflammation, hemodynamic dysregulation, impaired fibrinolytic activity, enhanced platelet aggregation, abnormal activation of signaling cascades such as protein kinase C or called as PKC, elevated ROS reactive oxygen species, abnormal stimulation of the RAS system. Clinical features. 1. I shall be dealing with diabetic retinopathy first, then diabetic neuropathy, then finally diabetic nephropathy. As far as diabetic retinopathy is concerned, it is a diabetic microvascular complication that can affect the peripheral retina, the macula, or both, and is a leading cause of visual disability and blindness in people with diabetes. The severity of diabetic retinopathy ranges from non-proliferative background versus pre-proliferative to more severe proliferative diabetic retinopathy in which the abnormal growth of new vessels occur. Total or partial visual loss can occur through a vitreous hemorrhage or retinal traction detachment, and central vein loss can also occur through retinal vessel leakage and subsequent diabetic macular edema called as DME. Diabetic retinopathy increases with prolonged duration of diabetes. In studies of type 1 diabetes and type 2 diabetes, after 5 to 10 years of diabetes, most patients had some form of diabetic retinopathy and over half had proliferative diabetic retinopathy. Diabetic retinopathy is also seen in 10% of patients with pre-diabetes as well. There are 4 stages of diabetic retinopathy and can also have diabetic macular edema separately or combined. Retinopathy is more associated with the presence of hypertension, higher BMI, younger age of onset, tobacco usage, insulin therapy, dyslipidemia, pregnancy, renal disease, elevated homocysteine levels, and fatty diet, and is a common etiology also for all subsequent diabetic micro and macroangiopathy. Diabetic neuropathy. Approximately one half of people with diabetes have some form of peripheral neuropathy, either polydiabetic or monodiabetic polyneuropathy. People with diabetes also frequently have autonomic neuropathy, including cardiovascular neuropathy, dysfunction, which is manifested as abnormal heart rate variability and vascular control. Neuropathy can lead usually to lower extremity sensation disturbances with loss at times and can cause extreme pain in lower limbs. This can further lead to foot ulcers and cause diabetic foot, which uncared can cause foot amputations. The main cause of peripheral neuropathy are poor glycemic control, age, duration of diabetes, tobacco usage, dyslipidemia, and hypertension, usually diastolic variety, presence of cardiovascular disease, and microalbumin is associated at times. Diabetes-related cardiac autoneopathy is frequently undiagnosed and can lead to resting tachycardia, exercise intolerance, resting heart rate variability, slow heart recovery after exercise, and orthostatic hypotension, including silent myocardial ischemia or infarction and sudden cardiac death. The incidence of autonomic neuropathy varies from 1 to 90%. To be lucky, could have only 1%. To could be unlucky, one could have as much as 90%. It can also lead to diabetic cardiomyopathy, which is more common than the coronary artery vascular disease, which is seen in diabetics. Diabetic nephropathy is the last variety of microvascular disease. It is a serious and progressive complication of both type 1 and type 2 diabetes. The first manifestation of diabetes nephropathy is typically microalbuminuria, with progress to overt albuminuria, and finally to nephrotic proteinuria and renal failure, and is the leading cause of end-stage renal disease called ESRD. Approximately 25% of people with type 2 diabetes have microalbuminuria or a more advanced stage of diabetic nephropathy that worsen at a rate of 2 to 3% per year. The risk factor again for diabetic nephropathy includes, as well as neuropathy, are all common, and they include hyperglycemia, duration of diabetes, age at onset, tobacco usage, dyslipidemia, hypertension, and obesity. These side effects are all common for neuropathy, nephropathy, and retinopathy. All the risk factors are the same. To conclude, friends, diabetes is associated with both macro and microvascular changes affecting numerous organs, including skeletal muscle, skin, heart, brain, and kidneys. Common risk factors of vascular disease in diabetes include hyperglycemia, insulin resistance, dyslipidemia, hypertension, tobacco use, and obesity, which, if properly controlled, can wade the way out of diabetes and its complications. I again repeat that the complications of the risk factors are same for all diabetic complications. Mechanisms for microvascular disease in diabetes include the pathologic effects of age accumulation, overproduction of endothelial growth factors, and abnormal stimulation of PKC, the polyol pathways, and the RAS system. Regular follow-ups and with your doctor and keeping risk factors under control, including blood pressure and blood sugars, at bay can issue from diabetic complications and usher in a normal life. Goodbye, all of you. Thank you again.